If I were to give you a true or false quiz on concussions, how would you do? Stay tuned for Health Watch. Hello, I'm Terrence Adfer Anderson, and this is Health Watch. By the time some of you see this edition of Health Watch, Super Bowl 47 will be history, and so will the 2012-2013 NFL season. But there is a nagging nemesis that could continue to plague all manner of professional and amateur athletes long after their respective seasons have ended. I'm talking about concussions. How much do you know about concussions? I'm going to give you an opportunity to test your knowledge in just a moment. But first, let's take a look at this most dominant and proliferating type of traumatic brain injury. The CDC, the Centers for Disease Control and Prevention, reports that each year an estimated 1,700,000 people sustain a traumatic brain injury, a TBI, and that 75%, 1,275,000 of these cases, are concussions or other forms of mild TBIs. The CDC also reports that traumatic brain injury is a contributing factor to a third of all injury-related deaths in the United States. Almost 500,000 emergency department visits for TBI are made annually by children aged 0 to 14 years. Each year, U.S. emergency departments treat an estimated 173,285 sports and recreation-related TBIs, including concussions, among children at adolescents from birth to 19 years. And that during the last decade, ED's visits for sports and recreation-related TBIs, again including concussions, among children and adolescents increased by 60%. Overall, the activities associated with the greatest number of TBI-related ED visits included bicycling, football, basketball, soccer, and playground activities. Yet you should also know that children aged 0 to 4 years, older adults aged 15 to 19, older adolescents aged 15 to 19 years, and adults aged 65 years and older are most likely to sustain a TBI, and that adults aged 75 years and older have the highest rates of TBI-related hospitalization and death. So, you see, we're talking about an injury that spreads across almost every age group. Now for the true and false quiz. To help us navigate through the concussion quiz, I have brought onto the show a real expert on this topic. It is my great pleasure to introduce Dr. Scott Sauter, Director, Hampton Roads Neuropsychology. A licensed clinical psychologist, Dr. Sauter received his PhD from Vanderbilt University and later completed his postdoctoral fellowship in neuropsychology at the University of Virginia School of Medicine. He is a member of the community faculty at the Eastern Virginia Medical School and is the chair of the Medical Science Committee of the Southeastern Virginia chapter of the Alzheimer's Association. Dr. Sauter is also a diplomat of the American Board of Professional Neuropsychology and is a fellow of the National Academy of Neuropsychology. Boy, those are impressive credentials, sir.
Thanks, sir.
And I'm so glad to have you on the show, and as you gathered in our early discussions, this is something I'm pretty excited about. So let's get into this true and false quiz. Now, I tipped our hand a little bit by giving some of the information at the beginning, but let's go for it. You ready?
Very good.
Okay, let's read the very first statement. A concussion is a brain injury. True or false?
True.
Okay, of course the answer to that is true. But a concussion is also defined as a traumatic brain injury. Now, you sent me an email about something called a neurometabolic cascade. Could you tell us what that is, as well as briefly describe a TBI?
Well, certainly. First of all, the neurometabolic cascade is the term that science uses about the mechanism of how concussion occurs. It's simply that the brain works by electricity and chemistry, so it's an influx of chemicals into the brain cell itself that disrupts the function of the brain. Too much glucose, for example, not enough oxygen, and the brain sputters, which then produces the symptoms of a concussion that you know of: dizziness, balance problems, nausea, headaches, things like that. A traumatic brain injury simply is a blow to the head or a immediate stopping of the brain moving inside the skull rapidly. Either of those two events that then result in a change in the clarity of one's thinking is a concussion, as long as it doesn't have structural damage to the brain, bleeding of the brain, or swelling of the brain. So a concussion could be very benign, such as hitting your head and having a lack of clarity of thinking, feeling dizzy or dazed, to being unconscious and then confused for a day, but no longer than a day, again with no structural changes to the brain. That's a concussion. That's how a traumatic brain injury occurs.
Now, when we were talking earlier, you also mentioned that the process of the brain, the way the brain works, is actually a metabolism. It's a metabolic process.
The way the brain functions is metabolism, and that's glucose uptake. That's its brain's fuel, and oxygen. It burns it like a combustion engine. So if you flood a combustion engine, your lawnmower, for example, it's got too much gas, not enough oxygen, it sputters. Your brain is sputtering because you've got too much glucose, not enough oxygen, among the other chemicals there. So during the time that you're experiencing the symptoms, the headache, the dizziness, the balance problem, the nauseousness, that's essentially the brain is not functioning well, and they call that neurometabolic cascade.
Okay. All right, now, I wanted to get to that because I found that completely fascinating. But let's get back to the true or false quiz here.
Very good.
And the second statement, this is a simple one as well, particularly for those that were paying attention. Concussions can occur in any organized or unorganized recreational sport or activity. True or false?
That's true.
Very good. We're going to advance further along here because I want to get into some other interesting conversation. The third statement. Now, beginning to get just a little bit harder, you can see that a concussion and some athletes may not experience and or report symptoms until hours or days after the injury. You can't see that a concussion in some athletes. Yeah.
That's true. You can essentially have an event that takes place that you can have evolving symptoms. And that's something that is of concern, and I think you're going to get back to that later about more significant problems.
The fourth statement, following a coach's rule for safety and the rules of the sport, practicing good sportsmanship at all times, and using the proper sports equipment are all ways that athletes can prevent a concussion. Now, I want to get to the true and false about that, but as you answered, you also spoke about a mandate established by the Virginia legislature. So if you could tell if that's true or false, and then elaborate on the Virginia legislature.
Certainly, that's very true. And that the way that one has technique, playing hard, playing safe is absolutely critical. Spearing somebody, dropping your head down and running into somebody is absolutely prohibited, and that's not coached anymore. That's could produce neck injuries or head injuries. So the way a person plays is really quite critical, and the technique that the coaches provide is absolutely imperative. The Virginia State Legislature in 2010 mandated that the Department of Education put into place that any school-age child that has a concussion in Virginia cannot return to play unless they're cleared by a healthcare professional who has experience in monitoring and managing concussions. Each school then was responsible for their protocol that they would put in place, not different essentially from professional teams, the university teams, the high school teams, all the way down through middle school and any school-age child.
I want to progress to these things pretty quickly. Statement number 5, and this is another easy one. Concussions can be caused by a fall or by a bump or blow to the head or body.
Absolutely. Essentially, a concussion is occurring by either a blow to the head or a rapid acceleration, deceleration of the head. The brain is the consistency of jello or yogurt inside a very hard case, the skull, and it can move inside there with velocity. And some of the more difficult injuries to manage are those that have a rotation rather than just a linear force. And then you're basically stretching and potentially causing a tear in brain tissue.
This is all pretty fascinating. Our sixth statement. Concussion can happen even if the athlete hasn't been knocked out or lost consciousness. You addressed that a little bit earlier.
It's not true that you have to have loss of consciousness to have a concussion or a brain injury. Again, all you need to have is a blow to the head or an acceleration, deceleration of the head that produces a change in the clarity of your thinking. Albeit that would be transitory if it was just a dazed type of feeling, but it could be more significant than that.
And we're going to talk about this a little bit later, but a little bit more later. I want to read statement number 7, but for our viewers that were paying maybe too close attention, the answer to that last statement was in fact true, that you don't necessarily have to be knocked out or lose consciousness. Statement number 7, symptoms. So again, we'll talk about those later. Nausea, headache, sensitivity to light or noise, and difficulty concentrating are some of the symptoms of a concussion. True or false? Very true. Okay, and we just have a couple more statements that we're going to review, but I want to stop for a moment so that you can elaborate a little bit more on the symptoms. What more can you tell us about symptoms? And we're going to put that information up on the screen as you talk.
Well, the CDC talks about symptom recognition, and the imperative aspect of this is the education aspect. If you have a blow to the head, or you have a sudden acceleration, deceleration of the head, and you have a change in the clarity of your thinking, and you experience symptoms such as immediate headache, feeling sick to your stomach, balance problems, slurred speech, difficulty organizing your thoughts, not recognizing where you are, what's going on, that person needs to be removed from whatever activity they are in, and they need to go see a healthcare provider.
One thing we also talked about, sir, was that there are 4 different categories of symptoms, and they may or may not be related, and there should be, every incident should be treated on an individual basis. What can you tell us about these categories? And
Certainly.
We'll put that information
Well, the different categories that the CDC talks about is thinking and remembering. We call those cognitive skills. Physical symptoms, that may be something like feeling dizzy, feeling sick to your stomach. Emotions or mood, you could be irritable, you could be anxious, you could be worried, and you could also have sleep difficulties. And we treat everybody as an individual. Everybody's brain is different than everybody else's brain. Even with identical twins, the brains are not the same because their experiences in developing the brain are different. So we treat every single person as being independent and different, and so the cluster of symptoms, although they're common, are not necessarily the same in every single person with a concussion.
Mm-hmm. And they absolutely can change. Yeah.
And they can change, and that's really what we're trying to monitor across time. The protocols that we put in place to monitor an individual after they had a concussion basically is to take a look at symptom complex and have them rate those symptoms on a scale from none through severe, and then monitor it across time. And we want to see that decreasing over time so that they're getting better, and encourage them. And once they're starting to decrease and symptoms are going away, their thinking is returning, at that point, once they're getting better, the plan is to gradually increase exertion. But initially, you don't want to do that. You want to rest. The treatment for concussions is rest. Mental rest and physical rest. You don't want to be playing video games, so you don't want to be watching a action TV show. It's rest. I tell athletes, if you break your ankle and it was flopping around, you wouldn't run on it. You would be on the couch with a cast on, resting. Same thing is true with the brain. You want to rest on the couch, relaxing. You don't want to have that stimulation. Until the symptoms start to go down, then you increase the exertion, but slowly and gradually.
Okay, let's get back to these true or false statements here. The next one, number 8. Is athletes who have a concussion should not return to play until they are symptom-free and have received approval from a doctor or healthcare professional. Again, this is something that we alluded to earlier as well.
This is absolutely critical. The idea is to rest until the symptoms start to abate and start to go away. There are some physicians who advocate that you should have no symptoms at all before you go back. I'm of the point of mind that if you have a close resolution to the symptoms, is to gradually increase your exertion. And that would be, the simplest form would be walking. But at the same time, monitoring any increase in symptoms. So if you're gradually increasing your exertion, physical exertion, and symptoms return, you need to back off that level of exertion. So the simplest one would be just walking at a regular pace. If you're feeling okay the next day, then you might want to walk in a brisk pace. And the next day after that, if you're okay, you jog. So the idea is gradual increasing the exertion over time, while at the same time monitoring for symptoms. If you have symptoms, you back off that level of exertion. If you don't, then you can increase it a little bit more. Again, being monitored by a healthcare provider.
Okay. Our last and final statement, a repeat concussion that occurs before the brain recovers from the first can slow recovery or increase the likelihood of having long-term problems.
This is the crux of the matter currently, and that we currently know from research that repeated concussions in close proximity no longer seem like a concussion without structural changes to the brain. At this point in time, if you have too many concussions in close proximity in time, you can actually start to change the structure of the brain. We know that from professional boxers. We know that now from professional football players. We know that from some college players. And this is something that really is starting to take hold of decision-making and policy about how to play and when a person should remove from play and stop playing.
Yeah, we were talking earlier about athletes Dewar and Sejas, the tragic end to their own lives. A lot of folks believe precipitated by the concussions that they had, progressive, sustaining multiple concussions. We made that quiz pretty easy. So when we get back, what I want to do is to get more into the meat of things. Okay.
Very good.
So let's take a bit of a break now.
Okay. Thanks, Terrence.
All right. So we're going to take a bit of a break right now, and when we come back, we're going to continue our discussion on concussions. Please stick around. Stay tuned. There's more to come.
So, do you have any questions?
What is your soup of the day?
We have a mulligatawny soup.
Oh, do you have any specials?
We have a steak special today.
Oh, how's that cooked?
That's pan-seared and then...
Does it come with a side dish? Is it grilled? Can I have it steamed?
So, what do you recommend?
What kind of pie do you have?
You an actor.
Aren't you from Ohio?
Any questions?
Ask questions. For the 10 questions everyone should know, go to ahrq.gov.
Welcome back to Health Watch. My guest today is Dr. Scott Sauter, a licensed clinical psychologist and the director of the Hampton Roads Neuropsychology Center. Is that the center, or is it just Hampton Roads Neuropsychology?
Hampton Roads Neuropsychology.
And you have two different locations?
Yes, there's one in Virginia Beach and one in Newport News.
Okay, we're going to get that contact information in a second.
Very good.
Now, as you know, that the predominance of sports concussions, the predominance of concussions are sports concussions, and most of those occur in schools and the elementary level, junior high, and
not
college
necessarily. I see a lot of children anywhere from school age through high school, including sports you wouldn't think about, such as cheerleading. When they throw a cheerleader up they miss the cheerleader, or the cheerleader kicks somebody in the head, or other types of sports like horseback riding. You wouldn't imagine, but if you get thrown from a horse, the velocity is pretty strong.
And that shakes that gelatin
right, the brain in the skull.
Now, the CDC refers to the diagnosis, management, and education when it comes to concussions. Can you tell us a little bit more about that? Can you elaborate just a bit? Well,
first of all, you want to make sure that you have good education, and the CDC material is free, and I welcome anybody to go there. Now, the first thing would be recognizing whether a concussion occurs. So if you see an event occurs and a person has a change in their behavior, that's potentially a concussion. They need to be removed from play at that time. Mm-hmm. And they should see a healthcare provider who is knowledgeable about concussion management. The people who observe the injury can take notes so that they can tell the doctor or the parents how the injury took place, what had occurred, whether there was loss of consciousness or not, what the symptoms were that they observed, how long these things lasted, and then have the parent then take the child or the athlete to a healthcare provider. And they should not be returned to play unless they're cleared. The biggest concern in my mind, and most other physicians as well, would be is if symptoms evolved past that and became much more severe, that would not be a concussion. So a person would have repeated vomiting, for example, or they had a seizure, or if they had imbalance, not being able to stand up, or they couldn't be awakened because of grogginess, or one pupil was larger than the other pupil. That's a medical emergency. They need to go immediately to the emergency room and to be evaluated. That's no longer concussion. That becomes much more severe brain injury, and so that's something that needs to be managed in terms of things getting rapidly worse, and they need to go to the hospital right then.
Now, is that the CTE you were telling me about?
Well, the CTE stands for chronic traumatic encephalopathy, and that's actually the consequence of a number of concussions over time, and it's actually a softening of brain tissue. In other words, the brain tissue is not getting innervated, it's not getting blood supply, and so it softens and it has basically atrophy, and that's what the CTE is, or chronic traumatic encephalopathy, from repeated concussions in close proximity observed in professional boxers, for example, or professional football players or hockey players even.
That kind of makes a great segue into my next question here. As I shared with you, I've actually had 3 concussions. The first one, I was a teenager playing sandlot football, got kicked in the head, and kept playing the game. You know, I'd go in the game and take myself out, go back in the game. And I remember going to, I must have been about 15, going to the hospital in the emergency room, and the doctor asked me a series of questions to see how far back my memory was. But I don't remember walking home. More recently, I had a concussion when I was actually performing in a play, and I had a pratfall, and I fell the wrong way and found myself having to go to the emergency room again. The second time, which is in the middle, probably much more severe, and I didn't go get myself checked out. And that was in an auto accident, a single car accident. I fell asleep at the wheel, hit a guardrail, and did remarkable damage to my car. But I managed to drive home. And I drove home with one hand over my eye because I had double vision. All right, so, but I didn't go to see anyone then. So that is progressively, but there was a span of years between each event. Is there something that I should concern myself with?
No, at this present time, the answer would be no. It's too much water underneath the bridge at this point.
Even though I slur my words when I speak?
Well, it could be a number of other reasons why that takes place. But I tell athletes that I played football from the time I was in the 4th grade all the way through college. I had concussions growing up as a kid. I got to be a doctor. The main thing is to be smart, play hard, follow education, and if you are injured, you got to tell people so you can be checked out and make sure you're safe. You only have one brain, and you got to take care of it.
You know, I noted earlier that people aged 75 years and older are more likely to be hospitalized or have death as a consequence of a concussion.
That's primarily because of falling.
Okay.
Older adults, they don't see well, perhaps they might trip on a rug or a piece of furniture and they fall. Two areas they get injured is their hips, they break a hip, or they hit their head. If they hit their head, they potentially could have either a concussion or a more severe problem. That severe problem would be bleeding in the brain. Then they'd have to be evaluated by a neurosurgeon to determine whether they actually have to have some type of surgery to correct that. But that's the problem, is that they don't see well. They may be a little bit difficult in terms of walking, and they may not see where they're going and then trip and fall.
But because of their age, they can't recover so
That's
well.
a good point. Younger individuals through the older individuals, their brains seem to be more vulnerable to injuries, and their recoveries are slower. We try to be much more conservative in managing a child or a young adolescent than a professional athlete. They tend to recover better. The adults tend to recover better. The younger folks do not. We take a little more conservative role. And the reason is more than likely that the brain is evolving and growing in children, and it may be in the reverse in older adults. It is not the structural integrity that it had before when they were younger. So that's true. Younger folks and older folks, we have to be more careful and conservative with them.
And as much as we're talking about those people that are more susceptible to the damaging, potentially damaging effects of concussions, let's talk about before we close the danger signs. Again, you made a little reference to some of this earlier. Danger signs of concussions in adults and then in children.
Very, very quickly, concussions, particularly a single concussion in an otherwise healthy individual, really should go away within days, weeks, not more than a few months. If it lingers, there's other things going on as well. The danger signs that are no longer a concussion would be very clearly that the person has lost consciousness. You don't have to have loss of consciousness to have a concussion, but if you do, that could be a more serious problem. The second issue is that if you have nauseousness to the point of vomiting, that is a serious sign. If you have one pupil that's larger than the other pupil, that's a medical emergency. If you have a seizure, that's certainly a medical emergency. So those are signs that, and if you're groggy and you can't wake the person up, that's also a medical emergency. Might be something that's more than just a concussion. Those things definitely have to go to the emergency room. If you get a knock on the head and you have a slight daze, you should be removed from play, but monitored by your coaches, your parents, and other people. You might be having to remove from other activities and rest, but that might not be a medical emergency where you have to go to the hospital. But the other signs, definitely that's a medical emergency.
Now, is that kind of similar for children?
It would be similar for children. Well, if you have a child who doesn't express themselves, they don't have language yet, there's a couple things there. That would be their disposition, their temperament, sleep pattern, appetite, nursing. If those things change and they're very disruptive, that's a medical emergency, and you should go to the emergency room.
Okay, but I want to make sure that we give some contact information for Hampton Roads Neuropsychology. You have 2 offices. Where are they located?
I have 2 offices, but it's the same phone number.
Okay.
And that makes it really easy. The phone number is 757-498-9585. So it's the same number, 498-9585 for either of the offices. The office in Virginia Beach is conveniently located near the Lynn Haven Mall, and the one that's in Newport News is conveniently located right off of 64 in the Oyster Point district. So both of the offices are pretty easy to get to.
Fantastic. I am so glad that you came onto the show today. Is there anything else you'd like to add before we close?
Thanks, Darren. I think the main issue is education. Learn all you can, play hard, and be safe.
And one thing that I think we may have touched upon, anytime somebody has a loss of consciousness following an injury, that is cause for concern.
That is, it simply means that there may be more of a difficult recovery.
Right.
One of the things that we find out that is the prognosis of how severe a problem is whether or not a person, how much they forget before the event and how much they forget after the event. That's called post-traumatic amnesia. And the part beforehand, that's called retrograde amnesia. And then after the accident, that's called anterograde. The length of time that a person doesn't remember the event, that is the severity of the problem. So you can have a small window, not so severe, a large window,
right,
much more severe.
Well, this has been very fascinating, and I'm glad you gave me a clean bill of health.
Thanks, Darren.
Yeah, thank you. I want to thank you for joining us for this edition of Health Watch. And remember, you can always catch previous editions of Health Watch online. But if you want to get to the concussion quiz that's provided by the CDC, the website is up on your screen now. You can go to that website, www.cdc.gov/concussion. As for the concussion quiz, it's www.cdc.gov/concussion/PDF/quiz, and you see the rest of it up on the screen there. And remember, you can catch previous editions of Health Watch online at www.norfolk.gov. Again, that's www.norfolk.gov. If you'd like to drop me a line, you can email me at terrence.affer-anderson@vdh.virginia.gov. Please also feel free to give me a call at 757-683-8836. For the Norfolk Department of Public Health, I'm Terrence Affer-Anderson, and this has been Health Watch.